are here at the annual meeting of the North American Menopause Society, and I am speaking with
Dr. Jelena Pavlovic from Albert Einstein College of Medicine and Montefiore Medical Center.
and you just gave a fabulous discussion of the impact of migraines and menopause. And I wonder, first of all, how big of an issue are migraines in menopause? A common thing, or?
So migraine is a common thing in menopause, and thank you for the kind words. Migraine is a common thing in menopause. Migraines do peak in late 30s, so the prevalence of migraine in the population among women is 18% in US, but the lifetime prevalence is close to 40%.
And in menopause, does it increase around?
So during menopause and especially postmenopausally, it decreases. So generally, the good news is that we can tell our patients when they come and they're quite unhappy with their headaches is that they're going to get better postmenopausally. But the bad part of that news is prior to achieving menopause, postmenopausal state, they're going to go through perimenopausal changes and through menopausal transition, and those are associated with increase in headache frequency. So women who have had migraine before and had on average 1 or 2 headache attacks, migraine attacks a month, which tends to be the frequency in the population, will often then have worsening of their headache and increase to 10, 15, sometimes even more, 20. In my practice, I see a lot of women who have 30 days of headache a month, which is
that's
a
terrible.
really, horrific burden of headache.
And how might these women experience their migraines? What happens?
So the typical definition of migraine, it's a moderate to severe headache. It's a headache that will often start unilaterally, often around the eye or on the side of the face, and then may spread throughout or may switch sides. It can be all over, and will often be associated with other symptoms such as nausea. Nausea can be mild, it doesn't have to be profound. Sometimes vomiting. As women age, they tend to vomit less frequently, and most importantly, photo and phonophobia as well, and those are sensitivity to light, sensitivity to sound. Some women can experience other neck pain, fatigue, weakness, increased feelings of eating or suppression of appetite, mood changes occasionally, but the typical story of migraine is I feel like going to lay down in a dark room and not talk to anyone. If you feel like that, you probably have a migraine.
Now, many women are on hormones or other medicines related to their symptoms for menopause. I wonder if you could address specifically the issue of hormones in menopause. What's the impact of that?
So in migraine, hormone therapy can be used in migraine for 2 things. First of all, a lot of migraine is hormonally regulated, and perimenopause, why we believe that there's this increase in headache frequency in perimenopause is because presumably due to the hormonal changes that are so rapidly undergoing through the perimenopause. So hormone therapy can be used to improve migraine in that setting. It can also be used for treatment of other symptoms in women with migraine. And we've seen in WHI in our both the observational cohort and the
Women's Health
Exactly,
Initiative.
Women's Health Initiative, thank you. In both the observational study and the hormone trial cohorts, that women with migraine tend to have more commonly vasomotor symptoms, more commonly have night sweats and cold, hot flashes, and particularly moderate and severe symptoms. So these women, even if their headaches are well controlled because they have migraine, they have a genetic predisposition to migraine, and seem to experience increased frequency or increased severity of other symptoms as well, may benefit from hormone therapy for that.
So hormones may be beneficial for some women with migraines. What about the presence of an aura or not having an aura before your migraine comes? Do you have any thoughts to share about that?
In terms of use of hormone therapy.
Exactly.
So, as you know, women who have migraine with aura use of oral contraceptives, which is not what you're asking me about, is contraindicated in them. And this often gets extended to women who have migraine with aura being told early on in their life that hormones are not for them. And they sort of go through life knowing this. So when they come to us, and they might have had, again, this 2 or 3 headache attacks for years, every month, and now they're going through perimenopause, and they were never on contraceptives because they were not supposed to be. And now they're going through perimenopause, they're in their 40s or early 50s, and they're having their headache is just going on and on, maybe, let's say, 15 headache attacks a month. And when they come to people like me who are headache subspecialists, we say, perhaps you could try hormone therapy, which then they say, well, but I was told I can't. And there is really, what is the point of this is that the hormone therapy, there's no evidence for contraindication of hormone therapy in migraine. We don't have good evidence for migraine with DORA, but presumption is that there's no reason for contraindication of hormone therapy in migraine with DORA. And the study that I just presented in the Women's Health Initiative confirms that. We did not, looking at new cardiovascular disease events in women with migraine, we did not see increased risk of cardiovascular disease overall cardiovascular disease events in women with migraine. And we also didn't see that hormone therapy modified that effect, suggesting that at least based on that, women can continue to use hormone therapy.
So it doesn't increase a woman's risk. Hormone therapy doesn't increase a woman in menopause with migraines risk for a heart attack or a stroke.
Based on the findings.
Based on what you know.
You could, yes.
Okay. Any other comments that you want to make about this for women in terms of migraines and midlife that you think are important for women to know?
Yes, I would like to comment. Well, first of all, that it will eventually get better, even if you're in a patch. These symptoms fluctuate and flare up and then again improve. So don't despair. There are many resources. American Migraine Foundation is a website. So Migraine Foundation is a foundation that advocates for patients and is sponsored by the American Headache Society and has a lot of helpful resources for patients as well. And there are new drug classes and new developments on the horizon that are particularly going to be useful in post-reproductive age women. So there are exciting times in the migraine world, and hopefully this will translate to better life of patients soon.
Thank you so much.
You're welcome.